If you've ever felt that deep, nagging pain right at the base of your thumb, well, you are in exactly the right place. Today, we're going to pull back the curtain on a very common cause of that pain, scaphotrapezio-trapezoid osteoarthritis. Yeah, it's a mouthful, I know, but don't worry, we're going to break it all down.
Does this sound a little too familiar? That frustrating, almost burning ache right where your thumb meets your wrist? You know, the kind of pain that makes simple, everyday things like turning a key or twisting the lid off a jar a total pain? Well, you're definitely not alone, and there's a very specific reason this happens.
All right, so here's our game plan. First, we'll talk about those symptoms. Then, we'll unmask the actual condition itself, what we call STTOA. From there, we'll walk through the non-surgical stuff. Then, take a look at the surgical options, and finally, wrap it all up with how you can figure out the right path for you. It's a clear roadmap to understanding what's going on.
So let's start right there, with that nagging pain. What are the classic signs you should be looking out for? Usually it starts as this slow, progressive ache, right on the thumb side of your wrist. You might start to feel a little weakness when you try to pinch something, or notice that, opening jars has become a real chore. But here's the thing you've got to know. These symptoms, they're really vague. They can easily be confused with a bunch of other wrist problems, which is exactly why getting a proper diagnosis is so important.
So now, let's get into the culprit itself, scaphotrapezio-trapezoid osteoarthritis, or, as we'll call it from now on, STTOA. Much easier, right?
Okay, so think of your wrist as being full of all these tiny little bones that have to work together perfectly, kind of like precision gears in a watch. The STT joint is where three of these key bones, the scaphoid, trapezium, and trapezoid, all come together. Osteoarthritis in this spot just means that the smooth, slick cartilage that lets them glide past each other has started to wear down. And when that happens, you get friction, inflammation, and pain.
And this is not some super rare thing either. In fact, after the main joint of the thumb and the big joint where your forearm meets your wrist, the STT joint is the third most common place to get arthritis in your entire hand and wrist.
So, who's most likely to get this? Well, the risk definitely goes up with age. It's also way more common in women. One study found a pretty staggering 4-to-1 ratio in women compared to men over 50. And having a history of some kind of wrist injury in the past, like a fracture, can also be a major factor.
Now here's a really critical piece of the puzzle. STT arthritis is not a solo act. It rarely shows up alone. A major study found that in a whopping 85% of cases, it's happening right alongside arthritis in the main thumb joint. Only about 15% of the time is it happening all by itself. And this is so important for doctors to know, because it means they have to look at the whole neighborhood, not just one joint, when they're planning a treatment.
And this quote right here, it perfectly captures one of the biggest challenges. What this means in plain English is that what a doctor sees on your X-ray often has very little to do with the pain you're actually feeling. You could have an X-ray that looks terrible but feel okay, or have an X-ray that looks pretty normal but be in a lot of pain. And that's exactly why a thorough, hands-on physical exam by a specialist is absolutely non-negotiable.
All right, so you've got a diagnosis. Now what? Well, the good news is the first line of defense almost never involves surgery. So let's look at what we call conservative treatments. I want you to think of it like a ladder. You always start on the bottom rung. That means simple things, like just changing the way you do certain activities that trigger the pain. If that's not enough, you climb to the next rung, bracing or splinting, which gives the joint some much-needed rest and support. Still hurting? The next step up is medication, like anti-inflammatories. And at the top of this ladder, you've got injections, like cortisone, that can go right into the joint for temporary relief.
And when it comes to those medications, there's a pretty clear consensus from the experts. The American College of Rheumatology, for example, strongly recommends oral NSAIDs, that's things like ibuprofen, as a first-line treatment for managing the symptoms of hand osteoarthritis. But what happens when you've climbed that whole ladder and the pain is still running your life? Well, that's when the conversation might start to shift towards surgical options.
Now, this is maybe the most important thing to get. There is no one-size-fits-all surgery for STT arthritis. It's just not how it works. The right procedures for you depends completely on your specific situation. Is the arthritis just in that one STT joint, or are its neighbors involved in the problem too?
So for those isolated cases, it usually boils down to two main choices:
On one hand, you've got what's called an arthrodesis, or a fusion. The goal here is basically to weld those three little bones into one solid piece. No more painful motion. This is often a good option for younger, really active people who do heavy labor. The biggest downside? Sometimes the bones just don't heal together and the recovery is long. On the other hand, you have a distal scaphoid resection. Here, the surgeon just removes the arthritic little piece of one of the bones to create more space. It's a simpler operation with a quicker recovery, but it can, in some cases, lead to some instability in the wrist down the road.
And remember that 85% number? When arthritis is in multiple spots, the surgery gets more complex. For instance, if the thumb joint is also shot, a surgeon might remove one of the wrist bones entirely to decompress the area. In really advanced cases that involve the whole wrist, they might have to do a major reconstruction, removing some bones and fusing others. The bottom line is, the more widespread the arthritis, the more tailored and complex the surgical fix has to be.
So all of this brings us to the most important question, and the final part of our explainer. How do you put all this information together and actually choose your path forward?
After hearing all of that, you're probably asking yourself the big question, right? Okay, just tell me, what is the single best treatment for STT arthritis?
And here's the answer, and it's really the most critical takeaway from everything we've talked about. There isn't one. The best option doesn't exist. The right path is a deeply personal decision, one that's made in a conversation between you and your hand surgeon. It's going to depend on your age, your job, your hobbies, the unique anatomy of your wrist, and exactly where the arthritis is. So the path forward is a custom job. The real question isn't what's best, it's what's best for me.